Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research, conducted by Angeli D. Nini and Rebecca S. Hess from the School of Veterinary Medicine at the University of Pennsylvania, investigates the development of a need for exogenous insulin treatment in dogs that initially present with high blood glucose levels. The researchers begin by highlighting that, unlike in human medicine, the definition of diabetes mellitus in dogs is not as clearly established. One suggestion has been to define overt diabetes in dogs based on a consistently high fasting blood glucose concentration exceeding 144 milligrams per deciliter. This proposition aimed to encourage further examination and refinement of this diagnostic criterion. More recently, another viewpoint suggests that diabetes mellitus in dogs could be defined by a fasted or non-fasted blood glucose concentration of 200 milligrams per deciliter or greater, especially if the dog shows clinical signs suggestive of diabetes that cannot be attributed to another condition, or if the dog is experiencing a severe hyperglycemic event like diabetic ketoacidosis. This latter definition also suggests that if there is uncertainty about the clinical signs, the blood glucose measurement should be repeated, or additional tests such as urinalysis or measurement of glycosylated proteins should be performed. For dogs with a blood glucose concentration between 126 and 200 milligrams per deciliter, with or without clinical signs, diabetes mellitus could be confirmed by documenting persistent high fasting blood glucose for more than 24 hours, or by finding increased levels of glycosylated proteins. These proposed definitions for canine diabetes mellitus draw inspiration, in part, from the diagnostic criteria used in human medicine for diabetes mellitus and prediabetes. In humans, a fasting blood glucose level between 100 and 125 milligrams per deciliter is considered prediabetes, while fasting level greater than 125 milligrams per deciliter indicates diabetes mellitus. Fasting in this context means having had nothing to eat for at least 8 hours. Additionally, a blood glucose measurement between 140 and 199 milligrams per deciliter 2 hours after a glucose tolerance test is suggestive of prediabetes in humans, whereas a level exceeding 199 milligrams per deciliter during such a test is consistent with diabetes mellitus. Furthermore, a randomly measured blood glucose concentration of 200 milligrams per deciliter or higher at any time, regardless of fasting status, is a diagnostic indicator of diabetes mellitus in humans. The study emphasizes the importance of accurately defining diabetes mellitus in dogs before the need for insulin therapy arises. Identifying dogs with diabetes early could potentially allow for interventions that might delay or even prevent the need for insulin and could possibly reverse the underlying disease processes. Furthermore, studying dogs in the early stages of the disease could significantly enhance our understanding of the causes and development of diabetes mellitus in this species. The researchers suggest that current research might be limited by predominantly focusing on dogs with advanced, insulin-dependent diabetes. Therefore, the primary goal of this study was to determine how many dogs with incidentally or randomly identified high blood glucose levels, who were not initially treated with insulin, eventually developed a need for exogenous insulin treatment consistent with a definitive diagnosis of diabetes mellitus. To answer this question, the researchers conducted a retrospective longitudinal study. They examined the electronic medical records of 1318 dogs seen at a university teaching hospital who had high blood glucose levels that were identified randomly and who were not being treated with insulin at the time of the measurement. The blood glucose concentrations were measured using an automated biochemical analyzer. High blood glucose was defined as any randomly identified measurement above 112 milligrams per deciliter, which was the upper limit of the reference range used by the laboratory. Moderate high blood glucose was defined as a level between 144 and 200 milligrams per deciliter, and pronounced high blood glucose was defined as a level of 200 milligrams per deciliter or greater. Dogs were classified as having insulin-treated diabetes mellitus if they were receiving insulin, or if they were euthanized or died during a diabetic crisis, such as diabetic ketoacidosis, before insulin treatment could be initiated. The researchers excluded dogs that were incorrectly coded as not having diabetes despite being on insulin, as well as dogs with high blood glucose levels resulting from a dextrose bolus or chocolate ingestion. They then attempted to follow up with the owners of these 1318 dogs between 7 and 12 years after the initial high blood glucose measurement to determine if they had subsequently developed a need for insulin treatment. Now, let's turn to the results of this extensive investigation. The researchers successfully contacted the owners of 824 of the 1318 dogs with randomly identified high blood glucose for follow-up information, representing about 62.5% of the initial group. Of these 824 dogs, only 29 dogs, or 3.5%, eventually developed insulin-treated diabetes mellitus over the follow-up period. Interestingly, of these 29 dogs that developed insulin-treated diabetes, only 3, 10%, had moderate high blood glucose initially, and only 2, 7%, had pronounced high blood glucose. This means that the majority of dogs, 24 out of 29 or 83%, who later required insulin had an initial random blood glucose concentration of 144 milligrams per deciliter or lower. Overall, most dogs with randomly identified high blood glucose and follow-up information, 795 out of 824 dogs, or 96.5%, did not develop insulin-treated diabetes mellitus during the 7 to 12 years of the study. The median initial blood glucose concentration in all dogs with randomly identified high blood glucose that eventually developed insulin-treated diabetes was 123 milligrams per deciliter, with a range from 113 to 281 milligrams per deciliter. The median time between the initial documentation of high blood glucose and the diagnosis of insulin-treated diabetes in these 29 dogs was approximately 1.6 years, ranging from about 0.1 to 8.2 years. Importantly, the study found no association between the degree of the initial high blood glucose and the time it took for the dogs to develop insulin-treated diabetes. Statistical analysis, using logistic regression, also determined that the initial random blood glucose concentration was not significantly associated with the subsequent development of insulin-treated diabetes. Looking specifically at the 58 dogs, 4% of the total study population that had a random blood glucose concentration of 200 milligrams per deciliter or greater, follow-up data was available for 43 of these dogs. The vast majority of these dogs, 41 out of 43 or 95%, did not develop insulin-treated diabetes. The 2 dogs with pronounced high blood glucose that did develop insulin-treated diabetes had specific circumstances. One dog was being treated for traumatic bite wounds and developed insulin-treated diabetes about 2.6 years after the initial high blood glucose was noted. The other dog was being treated with glucocorticoids for large cell lymphoma and developed insulin-treated diabetes relatively quickly, about 0.1 years after the initial high blood glucose measurement. The researchers also examined the blood glucose levels of dogs that did not develop insulin-treated diabetes over time. In 193 of the 795 dogs whose owners reported they did not develop insulin-treated diabetes, an additional blood glucose measurement was documented after the initial high reading. The median time interval between the initial high blood glucose and this follow-up measurement was about 2.2 years. The median follow-up blood glucose concentration in these dogs was 104 milligrams per deciliter. Interestingly, 53 of these 193 dogs, 27%, had persistent high blood glucose, defined as a level above 112 milligrams per deciliter, and in 5 of these dogs, the level was even above 144 milligrams per deciliter. The median age of dogs at the time the initial high blood glucose was documented was 8.0 years for both the dogs that did and did not eventually develop insulin-treated diabetes. This suggests that age at the time of initial hyperglycemia was not a differentiating factor. The study also considered other medical conditions that could potentially cause high blood glucose levels. Among the dogs with randomly identified high blood glucose that eventually developed insulin-treated diabetes, 13 out of 29 dogs, 45%, had another condition that could have contributed to the high glucose. The most common of these were treatment with glucocorticoids, 6 dogs, and hyperglycemia treated with trilostane, 5 dogs. Similarly, in the group of dogs with randomly identified high blood glucose that did not develop insulin-treated diabetes, a substantial number, 400 out of 795 dogs, 50%, had a concurrent condition that could have elevated their blood glucose. Again, the most frequent factors were glucocorticoid administration, 244 dogs, and hyperglycemia treated with trilostane, 54 dogs. Notably, there was no significant difference in the frequency of these other conditions, including glucocorticoid use, between the dogs that did and did not develop insulin-treated diabetes. Now, let's move on to the discussion of these findings. The researchers conclude that the vast majority of dogs with randomly identified high blood glucose, including those with moderate and pronounced hyperglycemia, did not develop a need for exogenous insulin treatment over the 7 to 12-year follow-up period. This key finding underscores the necessity of considering criteria beyond a single random high blood glucose measurement when defining overt diabetes mellitus in dogs. It also raises questions about the sole reliance on hyperglycemia for diagnosing overt diabetes in this species. Furthermore, while considering preventative measures for dogs with randomly identified high blood glucose to potentially delay or prevent the onset of insulin-treated diabetes might seem logical, the study's results suggest that such measures might not be necessary for most of these dogs since they do not progress to requiring insulin. In human medicine, preventive strategies for type 2 diabetes often focus on lifestyle modifications and management of associated conditions like hypertension and dyslipidemia. While obesity might not be directly linked to diabetes in dogs in the same way as in humans, conditions like hepatic lipidosis, hypertension, and dyslipidemia have been observed in dogs with diabetes. The researchers note that addressing these conditions is recommended in dogs regardless of their diabetes risk. For type 1 diabetes in humans, early detection involves genetic testing and identifying specific autoantibodies. It is thought that genetically predisposed individuals experience a trigger that initiates an autoimmune destruction of insulin-producing cells. However, in dogs with diabetes mellitus, the evidence for similar beta cell autoimmunity has been inconsistent. Therefore, the applicability of early detection and immunotherapies, as used in human type 1 diabetes, is currently questionable in canine diabetes. Despite the limitations in direct parallels with human diabetes prevention, the researchers emphasize that early identification of diabetes in dogs before insulin is needed still holds value. It could facilitate crucial research into the underlying mechanisms of the disease in dogs. For instance, while islet-specific autoantibodies are detected in humans at risk for type 1 diabetes years before clinical onset, studies in dogs have largely focused on those already with overt disease. Examining autoimmunity in dogs earlier in the disease process might reveal similar early markers. The study's findings that most dogs with any level of randomly identified high blood glucose did not develop insulin-treated diabetes, that most who did had only mildly elevated glucose initially, that there was no link between the initial glucose level and the time to developing insulin dependence, and that the initial glucose level was not a significant predictor of insulin-treated diabetes, all support the idea that a single random high blood glucose measurement is likely insufficient for defining overt diabetes mellitus in dogs. The researchers suggest that future research exploring the relationship between glycosylated proteins in dogs not yet on insulin and the subsequent development of insulin-treated diabetes could provide more insights. Additionally, prospective studies could evaluate the usefulness of repeating blood glucose measurements at specific intervals to better predict which dogs will eventually require insulin. The researchers acknowledge that many dogs in their study had other conditions, such as glucocorticoid administration or hyperdrenocorticism, that could have contributed to the randomly identified high blood glucose. It is possible that in some cases, the high glucose was a temporary consequence of these concurrent illnesses rather than an early sign of developing diabetes. Interestingly, the frequency of glucocorticoid use was similar in dogs that did and did not develop insulin-treated diabetes, suggesting that the observed hyperglycemia in many cases might have been related to these other conditions rather than an indication of underlying diabetes. The study did not find conclusive evidence to support naturally occurring pancreatitis as a significant cause of high blood glucose in dogs without diabetes. The researchers also discussed the incidence and prevalence of diabetes mellitus in dogs. While the exact incidence in the United States is unknown, a study in Sweden reported 13 new cases per 10,000 dog years at risk. Prevalence estimates in the United States, United Kingdom, and Australia range from 0.3% to 0.6%. The current study found that 3.5% of dogs with hyperglycemia and follow-up developed insulin-treated diabetes, a higher percentage than the reported prevalence in the general dog population. This suggests that while most dogs with high blood glucose do not progress to insulin dependence, the population with hyperglycemia might be at a higher risk compared to the general dog population. However, it's notable that among the dogs with hyperglycemia, the incidence of insulin-treated diabetes was similar to the general population prevalence in those with moderate or pronounced hyperglycemia. This highlights the complexity of using a single blood glucose measurement to predict the future development of diabetes. The researchers propose that future studies should directly compare the incidence of insulin-treated diabetes in dogs with and without varying degrees of randomly identified high blood glucose to determine if it is indeed a risk factor for the disease. The median age of dogs in the study, around 8 years at the time of initial high blood glucose, aligns with the median age of diagnosis for insulin-treated diabetes in the United States. However, some younger dogs in the study also presented with high blood glucose. Given that juvenile insulin-treated diabetes is rare, these younger dogs were unlikely to have had the disease at the initial measurement. The follow-up period of 7 to 12 years ensured that most of these dogs would have reached the typical age of diabetes diagnosis by the end of the study. The researchers acknowledged certain limitations of their study. One limitation is that the medical records did not consistently specify whether dogs were fasted for their blood glucose measurements. However, the standard protocol at their hospital is to fast dogs overnight before examinations, which suggests that many of the measurements were likely taken in fasted animals. Despite this, the American Diabetes Association's criterion of a random blood glucose of 200 milligrams per deciliter or greater as indicative of diabetes in humans, regardless of fasting, did not reliably predict the development of insulin-treated diabetes in this canine population, as 95% of dogs with such levels did not go on to require insulin. This further supports the need for dog-specific diagnostic criteria. Another limitation is that not all dogs had documented persistent hyperglycemia. However, the finding that some dogs without subsequent insulin-treated diabetes did have persistent high blood glucose indicates that this alone is also not a sufficient diagnostic criterion. The definition used for hyperdrenocorticism was based on treatment with trilostane or diagnostic confirmation without treatment, meaning some dogs with a suspicion might have indeed had the condition. Additionally, the retrospective nature of the study did not allow for assessment of stress as a contributing factor to hyperglycemia in some dogs. Finally, the study focused on the progression from hyperglycemia to insulin-treated diabetes and did not specifically investigate whether mild hyperglycemia is a risk factor for the disease. In conclusion, this study provides compelling evidence that most dogs with randomly identified hyperglycemia, including those with pronounced and persistent hyperglycemia, do not develop a need for exogenous insulin treatment. Furthermore, the initial blood glucose concentration was not a significant predictor of which dogs would eventually require insulin. The lack of association between the degree of initial hyperglycemia and the time to insulin dependence further supports this conclusion. Therefore, the researchers strongly suggest that criteria beyond a single randomly identified high blood glucose measurement are needed to improve the definition of overt diabetes mellitus in dogs that are not yet being treated with insulin. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.